Hey everybody, it's Dr. Dave Psychiatry. Thanks for coming to the YouTube channel today. Here to remind you once again that if medicine fixes your problem that you're having with your thoughts, feelings, or behaviors, then that is a medical problem, not a mental problem, the mantra of this channel. And hope that's encouraging. And day to day, when I see patients, I get feedback that it is encouraging, so I'm just going to keep doing it and hope it's helpful. So today I'm going to talk about something that's a little opposite of what sometimes I talk about, or I'll talk about a lot, is frequently patients will not get help because they don't want to. And they are encouraged by others, hey, you got to see somebody, you got to do something. And that's great when someone is trying to get you to help yourself. But the flip side is when you might not really need treatment, but someone else says that you do. So today, instead of talking about what you should do if you're just unwilling to get help for yourself, the question is, what do you do when someone says that you have a problem when in fact you sort of don't believe you do? And this really starts with a patient who says something to me like, well, I'm really only doing this to keep my wife happy, or I'm really only doing this to keep my husband happy, or I'm really only doing this because my boss says I have to. Well, the medical reality there is that if you're doing something that is not really medically appropriate for someone else, you shouldn't be doing it. Now, I call this treatment by proxy. And treatment by proxy, I use to refer to that situation where you're basically being treated by someone else for something that you don't really have. Now the word proxy, if you search that on the internet, P-R-O-X-Y, or treatment by proxy, you will find this name called Munchausen. M-U-N-C-H-A-U-S-E-N, I think it's spelled, Munchausen. You can find it. If you start Googling syndrome, Munch something syndrome, you'll get it. But Munchausen syndrome is a particular psychiatric diagnosis that happens when an individual, typically somebody's caregiver, basically falsifies a medical illness. So in its worst form, you have a parent that pathologically loves being in the caretaking role. So wanting to be a caregiver or a caretaker for a child, they might fabricate or even create an illness in someone. So they go to the pediatrician, well, my daughter has blank. Well, we don't really see that. Well, she's really got that. Okay, to keep the mom happy, we'll treat it. And that can be a fairly benign thing, or I've actually seen in training where a patient was brought to our hospital, this was long ago, decades ago, and she had these abscesses in her skin. A young child had these abscesses in her skin, and we couldn't figure out what was going on. Well, it turns out the caregiver, the mom, was using a syringe to inject dirty, very dirty water into the child's skin to give them these lesions so that she would have the opportunity to take the child to the doctor, complain about stuff, feel very good about herself and her caregiving role, which is obviously a very disturbed thought process. And probably if I had that patient today, I would address it directly and I would offer that person a dopamine suppressor, because if you have a pathological thought about something, then maybe your dopamine is here and it needs to come here. It borders on psychotic. Psychotic meaning not being based on reality, but because it's got that particular behavior of literally confessing that someone is sick or alleging someone is sick or creating sickness in someone, that's where the classic diagnosis of Munchausen syndrome comes from. Now, I'm not really talking about Munchausen today, although that's a pretty good explanation. What I'm really talking about is when someone's trying to pressure you to do something that you don't have, you have to politely find a way to say no. So in its most clear form in my office, wife says to husband, you have ADD, you need to get treatment for it. Well, husband comes to me and, do you have a hard time concentrating? No, not really. Do you feel like you get lost in start and stops and all sorts of stuff? No, not really. Okay, well, why does your wife say that? Well, she doesn't like that I do it this certain way. Okay, so if you don't do it her way, what happens? Well, she just says that I have ADD and I just need to get treatment for it. And until I go to a doctor, there's gonna be consequences with me. So I'm just gonna go to a doctor and tell you I've got ADD. So then I say, okay, well, but you don't really have those symptoms. No, I'm only doing this to keep my wife happy. Okay, that's treatment by proxy, and no good doctor should do that. So I'm just saying, I don't do that, and I don't believe any good doctor should do that. Imagine the medical parallel. My wife says I have high blood pressure, but my blood pressure manages normal, but she's not going to be happy until I take a blood pressure medicine because she's scared that I'm going to have a stroke. Well, we don't want your blood pressure to go too low, so we're not going to give you blood pressure medicine just because she said so. Or my husband says, I'm pre-diabetic, I need diabetes medicine. Okay, well, here's your sugars and here's your blood tests and everything that we can see. You don't have pre-diabetes. Well, my husband's not going to be happy until I take medicine for pre-diabetes because that's just what he says. Well, a good doctor wouldn't give you pre-diabetes medicine or diabetes medicine if you didn't have diabetes, and a good doctor wouldn't give you blood pressure medicine if you didn't have low blood pressure, and a good doctor wouldn't give you an norepinephrine booster for attention deficit disorder if you didn't have a norepinephrine shortage. So again, this is the opposite problem that we have normally, that someone will just, a patient will be just really struggling, and the family and surrounding people just beg and beg, please get help, please get help, please get help. And finally the patient will say, okay, fine, screw it. I've seen Dr. Holmes' videos, I'll go get help. Yeah, okay, that's what we normally talk about, but it's interesting that sometimes that happens in my office, that a patient will literally walk in and say, I don't really need this, but my spouse isn't going to be happy until I do something, so I'm only doing it for them. And the answer to that offer is, nope, not going to offer medical treatment where it's not necessary. So that's my little vignette on treatment by proxy and a little bit about Munchausen Syndrome, even though that's very rare. And if you want to read about that, there's lots of resources on the internet. But today I'm really emphasizing that this is not that level of severity. This is a common thing that happens in my office. And if someone is trying to get you to get treatment where you're not really sure that it's necessary, obviously listen to them, but tell the truth with your provider and decide what's right for you. So that's all I have to say about that today. I'm Dr. Dave Psychiatry. Thanks for coming to see me today.